Why do some patients have bleeding inside the eye again and again in spite of treatment? This is Dr. Anina Abraham from Advanced Retina Care. Yes, it is possible to have rebleeds inside the eye in spite of undergoing injections, laser treatment, or even surgery. In fact, there are patients who have undergone vitrectomy and a complete vitrectomy and still have rebleeds every now and then, and they need either injections or they need a wash. Why is it that there is no permanent cure for this sometimes? You must understand the reason for this bleed is because of the fragile new vessels which are growing on the retina in a case of diabetic retinopathy. Here I'm dealing only with diabetic retinopathy. There are other reasons why bleeding can happen inside the eye, like something called acute PVD, retinal tears, retinal vein occlusions. There are so many reasons for bleeding inside the eye. Your doctor needs to evaluate the cause for vitreous hemorrhage or blood inside the eye. We are here dealing with recurrent bleeding. What to do if it's bleeding again and again? First of all, your doctor needs to go inside and operate again. Sometimes the vitreous can remain attached to the periphery of the retina. Sometimes the vitreous can still be in the form of membrane stuck on the retina. These can cause rebleeds, especially if the vitreous is not removed completely. So a revitrectomy is what is advised if there is rebleeding. Sometimes just a wash is enough because a bleed at the time of the first surgery can cause some amount of oozing, and that would just require a wash. This is provided the vitrectomy was complete. The entire vitreous was removed. Now sometimes bleeding happens in spite of all this. Those cases would require injection of silicone oil. When you inject oil inside the eye, you kind of give a pressure on those new vessels and bleeding stops. The patient remains stable for a very long time till you remove the oil. Again, once you remove the oil, there is a chance of recurrent bleeding. Now, all this is a sign of avascularity to the retina. Blood is not flowing to the retina properly, and that's the reason why these new vessels have started creeping. That's the reason why this is going into an advanced stage. Normally, it should not happen if your treatment is done much earlier. So I would recommend patients to undergo treatment as soon as the diabetic retinopathy is detected in the early stage of PDR, instead of waiting for it to become a recurrent vitreous hemorrhage or waiting for tractional retinal detachment to form and then undergoing surgery. Sometimes just a surgery would be enough to take care of any type of bleeding. Most of the cases, in fact, do not recur. Most of the bleeds do not recur once vitrectomy is done and it is complete.